Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on muscle physiology and disorders, myasthenia gravis, Duchenne muscular dystrophy, and more, each with 4 answer choices and detailed explanations. Muscle physiology and disorders clinical vignettes. 1. Myasthenia gravis. A 28-year-old woman presents with fatigable muscle weakness that worsens throughout the day. She has ptosis and difficulty swallowing. An edrophonium test improves her symptoms. What is the pathophysiology of this condition? A. Antibodies against acetylcholine receptors. B. Antibodies against voltage-gated calcium channels. C. Loss of dystrophin protein. D. Mutation in myosin heavy chain. Answer A. Antibodies against acetylcholine receptors. Explanation: Myasthenia gravis, MG, is caused by autoantibodies targeting nicotinic ACH receptors at the neuromuscular junction, leading to fatigable weakness. Lambert-Eaton myasthenic syndrome. A 60-year-old man with a history of lung cancer presents with proximal muscle weakness that improves with activity. Reflexes are diminished but improve after repetitive stimulation. What is the underlying cause? A. Autoantibodies against presynaptic voltage-gated calcium channels. B. Autoantibodies against acetylcholine receptors. C. Loss of dystrophin. D. Myelin destruction in motor neurons. Answer A. Autoantibodies against presynaptic voltage-gated calcium channels. Explanation: LEMS is a paraneoplastic syndrome, often from small cell lung cancer, that impairs calcium-mediated acetylcholine release, leading to weakness that improves with activity. Duchenne muscular dystrophy. About a 4-year-old boy has proximal muscle weakness, frequent falls, and difficulty standing up from a seated position. Physical exam shows calf pseudohypertrophy. What is the genetic mutation? A. Dystrophin gene deletion. B. Myotonic dystrophy gene mutation. C. Mutation in ryanodine receptors. D. Autoantibodies against muscle-specific kinase. Answer A. Dystrophin gene deletion. Explanation: DMD is an X-linked recessive disorder caused by a frame shift deletion in the DMD gene, leading to the absence of dystrophin, which stabilizes muscle cells. 4. Becker muscular dystrophy, BMD. A 15-year-old boy presents with mild muscle weakness and calf hypertrophy. Genetic testing shows an in-frame mutation in the dystrophin gene. What is the difference between Becker and Duchenne muscular dystrophy? A. Becker is more severe than Duchenne. B. Becker has a complete loss of dystrophin. C. Becker has partially functional dystrophin. D. Becker is autosomal recessive. Answer C. Becker has partially functional dystrophin. Explanation: Becker MD is a milder form of DMD caused by an in-frame mutation, leading to partially functional dystrophin. 5. Myotonic dystrophy. A 35-year-old man presents with progressive distal muscle weakness, difficulty relaxing his grip, myotonia, cataracts, and frontal balding. What type of mutation is responsible? A. CTG repeat expansion. B. GA repeat expansion. C. Deletion of dystrophin. D. Autoantibodies against acetylcholine receptors. Answer: A. CTG repeat expansion. Explanation: Myotonic dystrophy is caused by a CTG repeat expansion in the DMPK gene, leading to delayed muscle relaxation and systemic involvement. Polymyositis. A 50-year-old woman presents with progressive proximal muscle weakness, but no skin rash. Muscle biopsy shows endomysial inflammation with CD8 plus T cells. What is the best treatment? A. NSAIDs. B. Methotrexate. C. Prednisone. D. IV immunoglobulins. Explanation: Polymyositis is an autoimmune inflammatory myopathy affecting proximal muscles treated with glucocorticoids, e.g. prednisone. Dermatomyositis. A 45-year-old woman presents with proximal muscle weakness and a heliotrope rash on her eyelids and Gottron's papules on her hands. What malignancy is most commonly associated? A. Small cell lung cancer. B. Breast cancer. C. Ovarian cancer. D. Melanoma. Answer C. Ovarian cancer. Explanation: Dermatomyositis is associated with malignancies, particularly ovarian cancer. 8. McArdle disease, glycogen storage disease type V. A Chad 20-year-old athlete experiences muscle cramps and weakness after exercise, relieved by rest. His urine turns dark after intense workouts. What enzyme deficiency is responsible? A. Glucose 6-phosphatase. B. Glycogen phosphorylase. C. Myophosphorylase. D. Acid maltase. Answer C. Myophosphorylase. Explanation: McArdle disease is a glycogen storage disorder due to myophosphorylase deficiency, causing exercise-induced muscle pain and myoglobinuria. Hatcher 9. Malignant hyperthermia. A 30-year-old man undergoes surgery with halothane anesthesia. Shortly after, he develops muscle rigidity, hyperthermia, and tachycardia. What is the mechanism of this condition? A. Autoantibodies against calcium channels. B. Mutation in ryanodine receptor. C. Acetylcholine receptor autoantibodies. D. Mitochondrial dysfunction. Answer B. Mutation in ryanodine receptor. Explanation: malignant hyperthermia is caused by a mutation in the ryanodine receptor, RYR1, leading to excessive calcium release from the sarcoplasmic reticulum, causing muscle rigidity and hyperthermia. ALS, amyotrophic lateral sclerosis. A 55-year-old man presents with progressive muscle weakness, difficulty swallowing, and both upper and lower motor neuron signs, spasticity and atrophy. What is the most effective treatment? A. Riluzole, B. Prednisone, C. Methotrexate, D. Pyridostigmine. Answer: explanation: ALS is a progressive neurodegenerative disease affecting motor neurons. Riluzole reduces glutamate toxicity and slows disease progression. These high-yield vignettes cover